In many developing countries, especially those with low literacy rates, radio can play a key role in promoting behavior change. C4D specialists such as Massimiliano Sani in Mozambique and Ndiaga Seck in the Democratic Republic of Congo have found that community radio, where people produce programs in local languages sensitive to social norms, is most effective.
We support community radios in producing regular programs every week on basically key facts for life behaviors and messages. So mainly child and maternal health, but also child protection, education, and other topics. And both at the adults and both children are basically not recruited but mobilized to in like children clubs or adults club in the radios to design their own program. So we give training, we give the content, but then there are themselves that basically adapt the key messages to the local reality. So doing this, we are trying to use, let's say, national standards, national modules, for example, on each of the key priority topics, but then the adaptation is done at local level, because of course every single community radio, they have to adapt the program in their own languages, and for example, and also using the cultural, adapting to the local cultural dimension of each district.
What we did was we started partnering radios. Partnering radios meant we trained them into many of our key family practices, and then we started urging them to do many broadcasts, many programs, and those programs were to be listened to by communities, but we also encouraged what we call listening clubs, so that families who listen, communities who listen can discuss after listening, and they can also let's say bring their opinion by phone or something. I don't know where you are, but use radio more than you do, and try to get people on radio trained first, trained and know what they're talking about, know the clarity and the simplicity. No, not to be very complex when they explain things, and try to get even members of the community be part of those radio programs. Try to get a mother who with positive deviance, for instance, knows well how to help badly nourished children to get better, and let her explain how she does that. You know, it would help a lot, because they will hear it from a peer rather than from an expert. You know, so radio is really something that we need to look at. We need to use more, and we need to use better. And then we definitely wanted to know if exactly what we're doing, we were on the right track. So we said we would do a CAP evaluation, like knowledge, attitude, and practices, to see how good radio could go along with community relays, because we had them there for a long time, and how well do they now work together. And what we realized was radio come second as the means or channel where communities got the right information. Why? Because people who did those, let's say, broadcasts, or who are invited on those broadcasts, were trained, and they knew what they were talking about, and they could also, after the broadcast, continue discussing within the communities. So to me, that CAP evaluation was quite something very revealing in terms of how far or how well can C4D help, let's say, communities, get key family practices. The follow-up interaction is also there. Like, if you have a good listening club, they always gather and discuss all that they heard on the radio. Yeah. Because to be honest, when we did our KAP study, we realized that many people don't have any other, let's say, entertainment than radio. So they listen to the radio. Yeah, they do. And we know the time when they do it. For example, 4 o'clock is the time when they come from the field or from the farms. So they come sit down with their family and listen to the radio. So we also targeted the time when we need to play those different, let's say, broadcast programs for many people to hear it and many people to pay attention. Sure. And yeah, it helps because they call
Sure.
or they discuss with you. And if a member of their community were on that program, they can also, let's say, continue discussing with them